So today we will try to take epidemiology and research and if feasible statistics also. All the three topics will go hand in hand and how that can be applied for software AP info. So integration will be helpful. So before I proceed, uh, if there's any question by Anita, you can ask me any question. So let us start with epidemiology. Now, the epidemiology is concerned with the occurrence of disease and other health-related problems in human population, whether it's a malaria or joint pain or whether it's diabetes or hypertension. Now, if someone asks you a question, can we study the epidemiology of diabetes? Usually the answer is yes. But if someone asks you a question, can we study epidemiology of headache? What will be your answer? Let us make it interactive. Can we study epidemiology of headache? What do you say, Anita? Epidemiology of body ache, epidemiology of abdominal pain. Is it possible to do research on such kind of things? Epidemiology can
Sir,
be
it
applied
is
to such events? Yes or no?
no, sir. It is only a symptom.
Okay, so the epidemiology now has broadened its horizon and health related problems, whether it's a disease or a symptom or sign or investigation, whatever it may be. Now we can apply epidemiology to such thing also. But for that, suppose if you want to study the epidemiology of headache, you need to define which kind of headache. There are headache, 100 types of headache. So it's a continuous headache, intermittent headache, headache for a short duration, headache for the long duration. All these things you should define. Then it is possible for epidemiology of headache. It is possible. So definition is very important. Now a headache can be severe or mild, moderate as per the perception of an individual. So uh, epidemiological study initially it was for only for infectious disease, and then it was for the non-communicable disease also. And nowadays, epidemiology you can study the health-related problems also, and hence the horizon of epidemiology has broadened. It's a cornerstone of public health practice. Whatever we are doing, suppose the COVID-19 came, who found out how it spread, what are the causes? All this was done by epidemiologists. Very meticulous. The defined definition have to develop. We have to develop the how it spreads and data analysis. The unfortunately in COVID-19, what happened? The data sharing across the world was not that common. The common platform was not there. Only the common platform was how many cases, how many tests, that was the common. But actually, individual data, who suffered and who didn't suffer, that was not there. And unfortunately, COVID 19 is the first epidemic in which the whole world went on a wrong way from the standard definition of epidemiology. In case of epidemiological definition, usually case means person who is suffering. Unfortunately, even anyone who was COVID positive was labeled as case. And that is the wrong thing across the world. It is an infection. Each infection doesn't mean it is a case. If I test for, let's say, do a test for tuberculosis, so many people can have positive reaction meant empty test positive could be there. That doesn't mean all those who are having empty the matrix is positive are suffering from disease. So that was the wrong thing, and that's why it is more important that large number of people should learn epidemiology. And so many problems we can understand if we use the epidemiology. Another classical example, which is a problem for a world to solve, sudden cardiac death. Now, sudden cardiac death and sudden death both are different things. So, sudden death, all sudden death may not be a sudden cardiac death. But then, why there is a sudden death? Why there is sudden cardiac death? Even if you do autopsy, sometimes you may not be able to catch the real reason. But in this case, if we do the study of thousands of cases of sudden death or sudden cardiac death, and we try to analyze the data on a common platform, then we'll be able to find out why it can happen like that. And mostly, if you look at the clinically or pathologically, sudden death can occur in youngster. Two reasons in cardiac as well possible blockage. Now, if you want to find out that, now so many investigation can find out the blockage early also. So just examine 10,000 youth for the blockage, and it is not necessary to inject and do that to find out the blockage. Another non-invasive methods are available to find out the blockage, and then we follow them the longitudinal. Other thing is those who have died, from them we need to find out maybe through autopsy whether there was a blockage or not. So both is control study and cause study can be utilized in such cases to find out the cause of the death. And usually there could be other thing is autoimmune response. Autoimmune response is something allergic response, anaphylaxis response, which can trigger sudden death in any individuals. And most of the deaths are suggestive that they are so sudden that you don't have any chance to save the person. So all these things can be learned under the epidemiology. So death is also one kind of event. So epidemiology of death can also be there. Now, what do we do in this? Describe and explain the disease occurrence in a community or population, how these disease states are influenced by heredity, biology, the environmental, and ways of living. If you want to find out whether it's a genetic problem or whether it is a environmental problem, what do you do? So there are twins, and out of twins, of course, almost same heredity. One person goes out other country, one person stays over here. Similarly, the three children, two children stays here, one children goes abroad. So such a familial relation you can find out and different environment. In this, emigration and immigration both can be considered between two countries, and you compare the data, then you can find out whether it's a genetic or whether it is a environment or both the combination. And this kind of study, we can definitely do it as in a collaboration with other countries. Now let's take one question. How many new cases of whooping cough were reported among teenagers in Canada last year? This is one of the slide from that. So it could be in our India or it could be in the Gujarat, etc. Now the word incidence and prevalence are not simple. Incidence and prevalence both are absolutely the denominators could be different. And denominators, if they are different, then you may not be able to correlate directly. But usually, new cases are incidence, and both if you include old and new cases, it is a prevalence. So, which word you should be using? In case of incidence, in a 1 year period, how many new cases occurred, not in a population, but in a risk population? While in case of prevalence, how many suffered, whether it is new or old, during a specific period of time in a population? That is a period prevalence. If you want to go for point prevalence, for example, today or maybe in just 1 or 2 days, how many people are suffering from dengue? That is a point prevalence. So, incident number of new cases, prevalence, what prevails. These are the two important words, incidence and prevalence. Now, the epidemiology, when we use the word, what is there in the population basically? What is there in the population? Epi means upon, demos means population, and logos means a science of people, right? Science of disease in people. The classical epidemiology concerns with the population, while clinical epidemiology is applicable to a hospital setup, clinical setup also. It talks about the particular diseases. And the classical epidemiology talks about the inner population, how many people are suffering from cold, how many people are suffering from diabetes, like this, no, in a population. And then it is also talking about the various factors, environmental, individual factors. You can go into depth in the committee. Same thing you can do in the hospital, but relatively finding out all the variables within a hospital setup is difficult. But nowadays, what we are doing in a medical college, we study the patient at a hospital as well as at home, and we combine this. Suppose across the India, there are 1 lakh medical students. Each of the medical students is taking, let's say, 5 families in urban area, 5 families in rural area, then 10 families. Then we'll have 10 lakh family longitudinal data each year. So you imagine within 10 years, we'll have a wonderful database in India to explore the things. And if we are successful in doing this, just think over what will happen across the globe. We'll be able to find a lot of things. Even in the longitudinal data, we can find out that few children or few adults are they become the criminals. We can find out their history in childhood. They were not given breastfeeding, or they were exposed to certain kind of the diet, or they were exposed to certain kind of knowledge, etc. What happened? Why they became the criminals like this? So all kind of things can be studied if we have long-term data available. Now, in epidemiology, if you want to identify the risk factors, so we need to, on first day, I talked about why. If you go for that kind of thing, you will be able to find out the risk factors, right? And the causes and risk factors both are almost overlapping each other. If I say the malaria parasite is causing malaria, but they alone may not be able to do it. There has to be other things which are mixing together. Why? Malaria parasite enters into the human body, mosquito breeding, then lack of immunity, so many other factors. If you go for why web of causation, you will find out a lot of risk factors. Then evaluation also possible with help of epidemiology, whether the improvement was there or not. We can explain the natural history of disease. Now, again, I take examples of COVID-19. Initially, when few cases came, we could not find out the natural history of disease. But across the world, when so many cases occurred, when we compiled the data together, those who are undergoing treatment, not going treatment, what was happening? It was very clear. Data analysis showed that those who were admitted in the hospitals, the death rate was much more. But it could be because they were severe, that's why they were taken to the hospital, that's why they died. So if you want to find out, evaluate something like this, we need to compare those who were having a similar symptoms, admitted and not admitted. If we do analysis like this, then we'll be able to find out whether the hospital was cause of death or not in case of COVID-19. Then it can also be used to estimate an individual risk of a specific health problem. So, if a person is smoking, then how much the risk that a person is more likely to have cancer, more likely to have cough and cold, more likely to have bronchial asthma, etc. And same way, population attributable risk. If you remove the smoking from the state, what will the reduction in the disease? Versus if you remove the effect of the tea, what will the effect? All this thing can be uh, studied under epidemiology. Now, when you want to complete the clinical picture, what happens? In hospital, you write down the treatment and patient goes back home, but whether you're cured or not cured, patient is not turning up again. There could be two reasons: because the patient cured didn't turn up, or because patient not improved, says this doctor treatment is not good, so let me go to the other doctor. So there may be so many reasons why patient are not turning up, right? So if you want to complete the clinical picture, interaction between the field work and the clinical work is very very essential, and that is the that is the function of the community medicine department in a medical college, who will have a liaison between the government sector and the private sector. Then epidemic investigation, whenever there is an outbreak occurring at a large scale or in a focal area, but so many cases are occurring, at that time also it will be useful. Now, the definition of epidemic is, usually we say that occurrence of a disease clearly in excess of expected. Now, what is the meaning of clearly in excess? So, usually we take a two standard deviation. But if there is a one case of cholera, for example, is no more in your area, so even one case of cholera can be considered as the epidemic. Next slide we take. Now, observational research. Usually, the researcher only observes the participant behavior, action, or other exposure to disease related factors in relation to the presence of disease. You are not doing something, you just observe, you just write down what is going on, and you are not doing any kind of intervention. Usually, when we describe the case, there is something like observational epidemiology, analytical epidemiology, experimental epidemiology, like this. You are not doing any experiment over here. And this is very good if you want to compare across the various pathies. What happens in Ayurveda? What happens in homeopathy? What happens in the allopathy? All this, if you want to compare across the pathis or across the various units within the medicine, you can start with observational study. In experimental study, you are giving some kind of treatment, different treatment, or you are in preventive side. For example, you are giving a vaccination, or you're asking to improve the hygiene or improve the diet, like this. And that is possible. And if you want to give a strong evidence, then the randomization is important. You have 100 volunteers randomized into two groups, one group exposed to placebo, other group you give the medicine, something like that. That is an experimental research. In descriptive study, define the characteristics of population, for example, case reports, case series, and simple cross-sectional survey. 10 cases, 15 cases, 30 cases, all this thing you write down and try to do the analysis, right? And in qualitative research methods, there the qualitative means two things. One is qualitative means the person, the gender, male or female, that is also qualitative. But in terms of qualitative research, it is like you try to understand the behavior of the people, understand the belief of the people, the uh, what kinds of practices they are doing. All this you observe, you discuss with them, you have a focus group discussion, your detailed case report, all together, that kind of qualitative research. And then there's a framework analysis. Whatever the patients are speaking, you analyze those words also, sentences also, their meaning also. That qualitative research is there, a bit more difficult and requires more the time of the a principal industry itself. It's not that somebody will do the data analysis. The person who is taking it to themselves herself try to do the analysis and are done when not much is known about disease. When the initial stages, when the disease are there, you don't know the even diagnosis. You need to go into each and every detail. For example, again, if we talk about COVID-19, not only simple data like age, gender, where do they stay, etc. But what were the first symptom? What was the second symptom? What went wrong? When they feel suffocation, when they were admitted to the hospital, what do they feel? Because of loneliness they died, or because of some real disease they died. All these things requires detailed description. In analysis study, right? Analytical study, it provides information about association of risk. There are so many variables now you have the quantitative variable, qualitative variable, and then you need to do the analysis. On that day, first day, we try to do the logistic regression analysis, which was contributing how much. That is the analytical studies. Now, broad headings will take about the epidemiological studies. One is descriptive study, another is analytical study, right? And you need not go through the whole chart. Just remember, forget this, that sometimes you have case and control. Go ahead with that. There is a case control study. Already case is established and go ahead with take a control, go ahead with that. And sometimes you have people together, let's say 500 people who are staying near the coal mines, another 500 people not staying in the coal mines, and follow them up and find out how many diseases are occurring. That will be the cause study. And across some city or across some rural area, at the same point of time, you are talking about whether they are exposed to a particular, uh, for example, smoking or not, diet, the type of the diet, type of the houses, etc. And whether they're suffering from cough and cold, fever, etc. So that's a cross section. At a single point of time, you are taking together. So case control study, cohort study, and cross-section study. But in experimental study, what do we do? You take 1,000 people, divide into two, three, four parts. For each, you do something other than differently, and then follow them up. So you have done randomization. That's why it's a randomized control trial. Now, qualitative study and quantitative study, right? Initially, you describe the things and just guess that this could be the thing. Usually, the case control study, cause study, even the cross-sex study, all this can be done. And later, the if you want to find out the actual reason, then we have to go for the experimental study. The time, place, person. These are the three things in epidemiology. You are describing that. But then why it occurs and how it occurs, that is the analytical study. Now, how do we decide which kind of study we'll be taking? The type of question asked by the researcher will determine the type of the study approach because usually when you are working in the clinical setup, you are in the medicine department and you want to find out the difference between two medicine. Initially at the time, you need to do randomized control trial, right? But in a society, if you want to find out the malnutrition, prevalence of the malnutrition, then you need to do cross-section study. So based on the question, we can find out which study should be done. So the type of study can generally be determined by asking what is the aim of study? What was the aim of the study? To simply describe the population, it is a qualitative study. To quantify the relation between factors, it is a quantitative study. For example, is age is increasing, what is the effect on the serum creatinine level? That's the quantifying the things. So you can have a qualitative study, quantitative study. In quantitative randomized control study, randomized crossover. Randomized crossover means initially one group, group A and group B are exposed to something. After 6 months, both are crossover. So that can also be done. Now this focus group discussion, interview, survey, etc. That is also part of qualitative study. And cohort study and case control study, they are also and part of qualitative. But it is not that qualitative study cannot have analysis, right? So we can do the analysis over here also, but that kind of analysis will be less powerful than this kind of analysis. So in a cohort study, both can be there, prospective and retrospective, while in case study, it has to be a retrospective study. A quantitative study design, it is for testing hypothesis. Now, in this case, null hypothesis, when we usually use the word in statistics, without null hypothesis, we are not going for the inference. For example, suppose there is a fall of some stone over here. Was there any reason or not? Yes, somebody throw it off. But then each time it falls in some particular area, but sometimes it falls away. That was some reason. Specifically, it was thrown away. So if it is in a particular range, it is by chance. But it's beyond that. That may be because of reason. That kind of analysis is done. And your hypothesis, even if it is far away, your hypothesis will be it is by chance. And then you find out, apply statistics and say that no, it is not by chance. So that kind of p value will be understanding. So P is probability of occurring event by chance. I repeat, P is probability of event occurring by chance that we're going to study when we talk about standard normal distribution curve. Now this variable word, I think this is now time for you to write down variables, two kinds of variable. One is a measurement variable, other is categorical variable. Where we want to write down very simple things, and all of you are supposed to write down in chat box. See, first we say that the characteristic or categorical variables or qualitative variable will be like gender, rural or urban, while measurement variable or continuous variable like height, weight, blood glucose level, like this. So both when we go for AP info, you need to understand this much, because when you're going to have measurement variables, means command is to be used, means of height, age, weight, blood sugar, etc. While in that we use table command, table, rural versus illness, like this. Rural or urban versus illness, yes or no. That we are going to use table command. So this is an important to understand. So Anita, Jalak and Vanraj, each one of you are requested to type first two characteristic variable. Just like two characteristic variable. This is a 25% of learning of statistics. Most of the people fail to understand this. This is a simple thing. Write down two characteristic variables, right? Like the gender, uh, rural, urban, or the caste, religion, all these things. In terms of the medical thing, whether the heart is left or right, sometimes dextrocardiac may be there, or person having disability or no disability, like this. It is concerned to, for example, one Raj in Ayurveda can say Vat, Pitta, or cough. That is a characteristic. You write down two measurement variable and two characteristic variable. Very simple thing. Because in characteristic variable, you are going to find out the percentage, proportion, and standard of proportion will be applied. Their standard of mean will be. So it's very, and it is a must for you to write down two variables. If you think of eyes, for example, spectacles, yes or no, that is the characteristic variable. But how many numbers, right? That is a, again, variable is a measurement variable, continuous variable. Blood pressure, yes, is measurement variable, yes. Write something else also. Yes, blood group is a characteristic variable, yes. Now, if I ask you a question, if I ask you a question, hemoglobin, what kind of variable this? Hemoglobin level, which kind of variable? Hemoglobin. Okay, measurement. Then if I say anemia, anemia, yes or no, what kind of variable this? Anemia, yes and no. It is characteristic. Okay, now if I write anemia, this is a very tricky, mild, moderate, and severe. Now, which kind of variable this is? Mild, moderate, severe. Is it measurable or characteristic variable? I repeat, mild, moderate, and severe. Is this mild, moderate, severe? Is this characteristic variable or categorical variable or measurement variable? See, in this case, what happens that if you have a data with you that mild anemia means 10 to 12, moderate means 8 to 10, and severe means 6 to 8 hemoglobin. If you have this kind of data with you, then it can be analyzed both way. It can be analyzed the as a measurement variable or a continuous variable also, and as category variable also. When the categorization is done on some measurement variable, you can use it both way. But ideally would be to use the raw data, exact hemoglobin level, rather than the grouping. And remember this for lifelong, that whenever you have a raw data available in terms of the measurement, try to avoid the category. Let's say age 5 to 10 is 10 to 15, 15 to 20. That kind of category should be avoided in statistical analysis as far as possible. This is a very simple uh, matter, but very useful thing. Avoid that whenever possible. Now, dependent variable, outcome, and independent variable. You are not usually age, lifestyle, treatment. They are not independent actually. But then As far as analysis is concerned, those who are independent variable, which you are not going to define, and based on that, what was the outcome variable. So it's not the word is have a medical meaning and not a literary meaning. Otherwise, treatment is not independent. Treatment also depends on the doctors, for example, right? So as far as the data analysis is concerned, you need to find out what are the factors input variable, what are the output variables. So that is the independent variable is input and output is the outcome. This what we are defining the variable. The independent variable, the experimental treatment or intervention that is imposed on the experimental group, right? So what treatment you are giving like this. So, and dependent variable is outcome. What happens to the blood sugar like this? For each study, you will have a different independent variable and sometimes the blood sugar could be a independent variable and the result gangrene occurred or not, right? That could be the outcome. So it based on the context which study you are doing. This is more important. You should write down that when a relationship between a dependent and independent variable has been observed, it is always possible that a different independent variable has produced the effect. So what happens actually? Uh, there is something like age, there is something like gender that may have effect on the outcome, not only your treatment or treating doctor, for example. That may also have effect not only the treatment but how the doctor is speaking. So some a variable which is related with both the independent variable and dependent variable. If it is related to both, then that could be one of the thing which is compounding, or even between the two to the independent variables or to dependent variables. It may cause the compounding variable something which affects both, and that may change the scenario. Very first day I talked to you that the urinary creatinine level and the glycosylated hemoglobin both were looking like associated with each other. But when the effect of age was removed, there was no relation between. You may think that the infectious disease should be more prevalent in the slum area, while the infected is less in the rich area. But what happened in the COVID-19? Rich people, so to say, better people were affected more in COVID-19 compared to the slums. What was the reason? So reason was probably that they were already exposed to so many infections. They were much more immune compared to the rest of the other rich people. So at that time, if we really want to find the difference, then there could be certain rich people within the slum also. There could be poor people in outside also, say made staying somewhere else. So poverty, if that's the reason that we can eliminate by taking such kind of the comparison. For example, when we did a study on the gully tap workers and sewage workers, we want to find out in sewage worker are they affected because of sewage. So we take as a control the gully tap worker. They are not exposed to the sewerage, but they are having the same social characteristic, same environment with the staying, social conditions, everything almost same except their work style. So that we compared so that we can avoid the compounding variable. Right? Now these words are not at all useful, but sometimes in literature they use these words. Continuous quantitative variable, discrete variable, whole numbers, qualitative variables. Nominal means you need to say the what we say the characteristic variable, right? Nominal. The gender, male or female, or smoker, non-smoker. That is a nominal type of data. Ordinal is category. Category mild, moderate, severe. There's an ordinal data. And the interval data. No true 0 point on that is for only few things are there interval data like the Fahrenheit or the temperature which we measure. And most of the time we have, when we talk about the measurement variable or continuous variable, usually we mean height, weight like this, hemoglobin level, etc. Right? This will be useful when we use AP info. So we'll take up certain questions and then you can think of any question before we start another slide. Now, this deductive and inductive. These two words in medical research we need to understand because when we want to develop a theory or when we want to accept the theory or refuse the theory, these two things are very important. Why do we do research? Excitement of making new discoveries. For example, we found a vitamin A deficiency detection machine, or somebody founding some the very extract of some herbal medicine and useful in the um, particular disease. For example, calomelain is useful for the malaria, which is a extract from the earth. In Hindi, probably, in Gujarat, we call it akda na pan. हनुमान जी को जो ऑफर करते हैं ना, वेरी यूजफुल. Pursuit of prestige, driven by passion, search of recognition, and now publish or perish, publish and succeed otherwise. So research is important for career also. Now I will tell you an interesting thing. A new medicine having just 10 rupees. An old medicine was costing 1000 rupees. A person claims that my 10 rupees medicine is equivalent to the 10,000 medicine. What he does, takes 10 cases over here, 10 cases over here. So when we compare the disease result, compares the result, there is no significant the difference between two medicine because sample size is less, significance is not there. So doctor doesn't care about the sample size. So what happens in such cases? Beta error is much more rather than the alpha error could be any, but the beta is much more in this case, and that's why we should not accept such study. So we need to develop a critical attitude. We have a chance to study subject in depth because if you are studying your post graduation in so many things you are doing in the pediatrics, but when you go into depth on one topic, at that time something new will come up. Of course, now is the online library people are going to use and critical faculty. That means something challenging. You said, I will give an example. A resident doctor gave a lot of dose of electrolyte and was very enthusiastic talk about the madam that madam, see, my child improved with this dose. I calculated the right thing. So madam told that it was not due to your right calculation. Your calculation was totally wrong. But in spite of your dose, child survived. That is the luck of the child, not is your good calculation. So the word in spite of and because of is very, very important that you can understand if you use a large database. And that's why I emphasize that whatever you want to do, try to do a multi-centric research study. For example, in Gujarat, so many PSM departments combine together and does the study, and that's why it's very, very effective. We need to do the meticulous experimentation, observation, systematic and analysis also. That is very, very important. Now, in this case, first we need to write down what are the objectives. Then, if we have some kind of reason, give a logical reason, then formulate the hypothesis and predict other possibilities. You may not be, you may not have achieved because of that. I will give an example. The child was given the a tablet, the lopamide, right? And another child was given ORS. Both child recovered. So you cannot say the lopamide was good or ORS was good. But if you have more cases together, then you will find out that one case of child who received a lopamide had a distended abdomen, right? And because of secretion was there, but was no outlet was not there, and that child was on the verge of death, was saved very, very the with a very uh, intensive the measurements. So small number observation if are done meticulously, but you collect some other data, try to collaborate with others, then you will be able to find out some hypothesis and repeat the experiment and see whether you find the same result or not. Now, these two things, observation and reasoning. With the five senses, we observe, right? And then with our mind and intellect, we give a reason. In this case, logic without observation is wrong, and observation without reasoning is also wrong. So in science, we require both. And that's why last few minutes, but very, very important, inductive reasoning and deductive reasoning. This you need to uh, understand because whenever we develop the theory, we need to confirm whether it's true or not. So from specific to the general, we make observation and perceive a pattern, make a generalization, that is a inductive reasoning. So specific to general, it is inductive. And deductive, we make a theory, make a prediction, do the experiment, and find out whether this is happening like that or not in deductive. So from observation, if you develop your hypothesis, then there is a inductive. In deductive, from theory, you go to observation and find out whether it is true or not. Theory confirmed, theory rejected. So, in medical research, it involves both inductive and deductive approach. We'll give very, very simple example, but very good to understand. Inductive approach. Women tend to have lower heart attack rate. This is an observation. Postmenopausal women have much higher heart attack rates after menopause, and postmenopausal women on estrogens tend to have a lower heart attack rates. So we might think that estrogen offers protection from heart attack. That is an inductive approach. Inductive, right? Observation to theory. Now what happens? The reverse way, deductive approach. If suppose estrogen offers a protection from heart attack, control trial involving postmenopausal women give estrogen to one group, other no estrogen. But it shows that there is no extra protection. So we refuse. So this is a deductive approach, theory to experiment. But basically, both are inductive and deductive. They are to be seen in a continuum, and we should try to use both together in medical research. And then ultimately, we should be coming up with final theory. Another example that green leaf vegetable consumption is associated with lower incidence of lung cancer. Green leaf vegetables are rich in vitamin A, and synthetic beta carotene reverses early pre-malignant changes in epithelium. So, looking at this, we say that beta carotene may offer protection from lung cancer, but we can try to do other way around also. We give a beta carotene may offer protection from lung cancer. So let's say, let us do the experiment. Randomized control trials using beta carotene and placebo care studies, we observed that cancer incidence was higher among those who received beta carotene supplements. That means beta carotene may offer no protection from lung cancer. So this is how the induction and deduction goes on. One kind of people say that every instance of affirmative evidence further strengthens the theory, and scientists devise experiments to provide affirmative evidence. Yes, it is positive evidence. Other group says a real role of scientists is to devise experiments aimed at refuting a theory, and theory presumed to be true till it has been refuted by an experiment. So both teams we should work together, deductive and inductive, and then we should decide. So next time we'll be talking about all of you are requested to take some topic in mind, take a research topic, and we should try to divide into various methods. The same topic, you do case control study, cause study, randomized control, crossing, everything on the same problem, and then it will be much better. Now I ask you a question. Have you downloaded AP Info? Is there any problem in downloading AP Info software? Have you downloaded? You can download from here. Search AP Info. Download AP Info, right? Uh, this is a zip file, and once you download the zip file, download the installer. When you press installer, automatically this will be installed. This is how you should use it. You can go to the website of cdc.gov AP Info, and once you do this, then you will have these two files with you: launch AP Info 7 and Info 7 folder. This folder will have various files in which this is the projects files in which all the projects are there, and we are going to use sample project over here. In that also frequently use Oswego file. This is what we should be using. You have been given a whole folder Google Drive in which all the files are given, and try to see most of the files. And once you have these two files, this zip file will be like this folder, and installer will be like this, which will install, and one file will be outside. This launch AP info. This you should press and should open up the AP info software. And you should be using first classical. In classical, first thing you should read the file. And reading the file, browse. In that, you go to the projects. In project also, you go to the sample. And if you can't do this, you can bring this file to desktop also. And you can select from the desktop if you don't remember where your file is there. And out of this, you can go for Oswego file, say OK. And then once you have read the file, once it shows the 75 records are there, then you can start using the command. The simplest table command, exposure variable, is what milk versus illness. And okay. So it will give you milk versus illness. Four people took a milk, 2% sick, 2% were not sick, 71% didn't took the milk, 44 sick, and 37 not sick. But the data is too small to find out that it is significant or not. So p value, if you see, is zero point 0.6, right? If you see, and even if you see it over here, so two tail, you can see chi-square value zero point 0.6 means 60% chances that this is because of some by chance. And if it is 0.05, that means only 1 out of 20. So 5% chances that it is by chance, so it is significant. That p value we'll see later on. But if you look at this tables, this is the last verse, right? When we say vanilla versus sickness, illness, look at this data. 54 took vanilla, 43, there's 79% fall sick. And when 21, only 14% were sick. Here 79%, here 40%. This is the raw percentage. This is a raw percentage. 6.5 and 93 is a column percentage out of this, right? So may take some time. You spend some time. If there is a confusion, you can ask me. So the difference is so significant that if you look at the p-value over here, that was zero point 0.6. It is 0.000, much less than 0.05. That means this association between the vanilla and illness is too much. You can say that it is significantly. It is not that by chance because of vanilla people fail it. Vanilla has something which leads to illness. So this with AP Info will help you. You download it and try to use it. Now the forum is open for the question. Any question? Jalaki, Madri, Anita, and someone else also. So next time I'll be asking you certain topics which you decided for which you want to um do the further study, right? And try to identify your population, subject, and whom you would like to involve as a colleague, etc. So you should write down something in chat box if there's any question, or you can open up the mic and ask. Right? Okay. So next time, I hope everybody should have downloaded AP Info software. We'll be going for simple statistics, standard of mean, standard of proportion, etc., and a very simple way of calculating sample size. And then the third lecture, after that, we'll be integrating AP Info, statistics, and research. I request all of you to keep some subject in mind, proposal in mind. So the after 2, 3 sessions, we'll be talking about how to develop the project proposal. Okay, thank you.